right. Thank you so much for tuning in to the Lionel B Show. And we have a special guest with us today. May we have your name?
My name is Nicole.
All right. Thank you, Nicole. And what is your profession?
I'm an ER nurse. I've
Okay.
been doing nursing for 17 years.
Okay. Nice. All right. And you're currently located in what state?
I'm in California.
You're in California. Okay. So as we can kind of see, things have been pretty rough, it seems like, in California in particular. We pretty much seen like so much in the news lately about, the coronavirus stressing out our medical professionals. Within California, are you seeing more people coming in with symptoms of the coronavirus, of COVID-19?
So that's hard to say because the tests can take up to 3 days. But I do see a lot of patients come in with symptoms like shortness of breath, fever, and cough.
Okay.
And those patients are usually, once you come in, when you say those things, you're automatically isolated. So I don't know if you have corona. You could just have a simple cold, you have a flu, or you can have something else. But once you say those 3 things, you're going to be automatically isolated.
Oh, wow. Okay. So pretty much there is kind of like a quarantine area within the hospital where people get isolated to?
Yes.
Oh.
Some hospitals are building forts outside.
Mm-hmm.
I work the night shift, so our patients go into what you call negative pressure rooms. So they go into a certain part of the hospital that we have just for COVID, where we lock the doors. Literally, the outside world can see us, and we can see you guys, and we can just look through a glass window, and that's it.
Boom. All right. So there's basically been a lot of theories. Some people saying it's made up. Can you tell us what you've seen, and do you believe this is actually a real deadly virus?
So I do believe it's a serious virus that's affecting our country, but I also believe that fear, thinking mentally that you're sick, and then other underlying conditions like SOB, which is shortness of breath. If you have any heart conditions, asthma, things like that, and being a certain age group, those things affect you more. So there's like COVID, and then there's these other like underlying conditions that you have. So COVID, it just highlights it and just makes it worse. But it's also just having like a bad respiratory infection, like a bad virus.
So kind of similar to like pneumonia, because I've seen a lot of people saying they have pneumonia and COVID.
Yeah, sort of like. I mean, so like what happens is with anything, let's say you have a heart condition and then you have COVID. COVID's just going to make that heart condition worse.
Oh, wow.
So anything you have, it just adds on top of it, and it just makes the situation even bigger.
Kind of just compounds the the everything that you're going through at the time.
Correct.
Now, being that you have been a nurse for 17 years, and you have been on the front lines during the pandemic, what's some of the common symptoms that you've typically seen while you're at work?
So most of the patients come in and shortness of breath, it's fever, and it's cough. Those are the 3 main things. But you can have one without the other. So I have patients that are coming in that have shortness of breath. And again, when those patients come in and you say those words, you're isolated because they've kind of put this fear into people that those things mean COVID. So that's why you see people running around that, oh, you cough, and they have this kind of fear because a lot of people believe that it's airborne. Right. So I can just get it.
Do you believe it's airborne?
Come in, I believe it is.
Okay.
I believe, I don't believe that it's as serious as people are making it out to be. But like I said earlier, I believe that with fear and just thinking about it, it makes situations even worse. So if you come in, because I have patients, and it's the same thing like with anything else, like anxiety. Mm-hmm. A lot of people think that when they come in, like, oh, I'm having a heart attack. You're not having a heart attack. You're having anxiety. But the symptoms that they feel are real. And they really feel like they're having a heart attack, but they're not. It's just anxiety. So if you tell a group of people that you're going to die from something or it's a cough, so what does everybody think? Oh, because I have a cough, I have COVID, or I have a cough that I'm going to die. Right. Or and it makes the situation even worse. And you
Mm,
might just be perfectly fine, but mentally you're thinking something, and mentally it can change everything about yourself. I mean, we see all the time how stress can affect a person. It can
right.
age you. um, it can make you feel worse. It could take a toll over you the way you look, and that's just by mentally thinking something. So if you tell a group of people something, it's going to make them feel a certain way, and it's going to make a situation worse, like right now.
Yeah, got you. Well, that's definitely real. I can certainly understand that. Anxiety definitely strikes fear in people, and what worse than to have something like this going on to just make people spiral out of control.
Right.
Now, there's actually been a lot of reports that are showing that people are dying really quickly when they actually come into the hospital. Why do you think that is?
So it's funny because I was just talking about this the other day with a few people, and my thing is our response time. So I think a lot of patients. So when you hear on the news, patient died from COVID. My thing is, how long did it take the medical professionals to get to that patient? So in my hospital, what we're doing is before you can even come into the building, before you can be triaged, um, if a patient says like they have shortness of breath, fever, or cough, there's things I have to suit up first. So before I can even get to you, I have to suit up. Now, in the past, it wasn't like that. If you told me I have shortness of breath or a chest pain, I was rushing to you. I was coming right away to you. We even had to do where we had to, like, if we had a stroke patient, we had to treat the stroke patient and do certain things with that stroke patient within a certain time frame. I believe it was like under 5 minutes.
Mm,
Now you come in and you say, I have a chest pain. I can't breathe. You know what? Hold on. Wait a minute. Let me suit up first, and then I'm going to get to you. So what does that happen for the patient? The patient is just getting worse and worse and worse and worse and worse. Now think about that in a patient that is about 80 years old that can't breathe. What is the chance of that patient surviving?
right, because
Very
timing
slim.
is everything in there, I imagine.
Timing is always everything. And
Wow.
that's what especially with oxygen and breathing, that's what you need to survive. So if you don't have that, what do you think, that's when this patient is coming in, what do you think is going to happen? And but we're going to blame it on COVID. We're going to say the patient died because of COVID, but really it wasn't COVID, it was the response time to get to the patient.
So potentially some of the actual patients that do come in and they do end up passing away, you feel like they could potentially be helped if the response time is a lot quicker.
I believe so, but it's one of those situations, you damned if you don't, if you damned if you do. Because at the same time I have to protect myself, right? I have to make sure I'm safe.
Right.
So, but the problem is that I don't know if you have COVID. You could just be having a heart attack. But the
Mhm.
thing is, I'm treating it as you have COVID. So, because that's what we're learning, right? We're learning that, again, I'm saying it, shortness of breath, fever, and cough, those are COVID symptoms. So, anything like that, I'm going to treat it as if it's COVID.
Right.
So
So,
I have to protect myself first.
so it's pretty much that's kind of, I guess, is that kind of like the secret knowledge of health professionals that, okay, these three signs, just kind of, we're going to kind of stand back from them and, just, suit up, do what we got to do. And how long does the suit up time take?
Suit up time, it depends. Being honest, right now, with us not having all the supplies that we need, suit up time can take even longer. Suit up time can take about, I would say, less than a minute. And I know for some that might say, oh, less than a minute, that's really quick. But not when a person can't breathe, not when a person is having a heart attack. So
Yeah.
every minute, every second counts when a person can't breathe. Every second counts when a person is having a heart attack. So those things are important. Um, so like I said, it could take about less than a minute, but that's a long time.
Right. I got you. Now another question, 'cause, based on, what you just mentioned there, do you
Mhm.
feel like the sense of humanity has kind of been left on the floor, because medical professionals just don't want to deal with potential coronavirus patients? Because, you guys have families as well.
I do. I think it's hard because um, you put us, a lot of people, well, I don't want to say you, but we're in a situation where we have to make a choice. I have kids. So do I want to take something home to my children? And I don't. We don't get all the information. We're getting information probably just as slow and fast as everybody else, which isn't fair because I'm on the front line and a lot of the higher ups aren't. So they tell us what to do and they're not actually being in the room with the patients. They're not treating the patient. So it's easier for somebody on the outside looking in and say, do it this way. But they're protected. They go home to their families, they're clean, they don't have to worry about anything. But I do.
So they're pretty much behind a glass shield, just kind of barking orders out.
Not even further than a glass shield because this is
Wow.
management higher up. They're through emails.
Oh
So
man.
not even through a glass shield. So you're getting your messages by email and phones and text messages. And, we don't want to come in because we don't want to infect ourselves and anybody else. So yeah, it's easy for them. They can work from home. I can't.
Oh wow.
You can send an email from anywhere. You can send an email from your car. You can send an email from your house. My job, I have to be there and I got to be there for the patients and the people.
Gotcha. Now that brings me to another question as well, like the shortage of personal protection equipment, or PPE, most people calling
Mm-hmm.
it. Does that actually scare you, being that there's a shortage?
It does because, first of all, one thing is it's not clean. It's not sterile. It's not healthy that I'm using something all day. I had to lie actually the other day and say that I sneezed into my mask in order to get a new mask.
Oh man.
But before I would change my mask, before I would go in with a new patient. So I go on with one patient. Okay, I'm taking my mask off. I'm throwing it away. I'll go on with another patient. I'm taking it off and throwing it away. Now I'm having to reuse that mask with every patient.
Ooh.
And I know there is a shortage. And again, I'm saying things like you're damned if you do, you damned if you don't. And I do understand we have a shortage, but there's just some things you have to have. I mean, some things you can't have a shortage on.
Right.
Some things you need to survive. It's just like masks right now are just as important as food and water are.
Yeah.
I shouldn't have to go in a room with a patient with the same mask on that I just came out the room with another patient. I shouldn't have to reuse gowns and certain things like that. I think the only thing that we've been actually good on is gloves. I haven't had to reuse gloves, thank God.
Yeah, it seems like
But
there's
everything
plenty of
else I've had
gloves
to.
everywhere. You can get gloves next
Right.
day, but the masks, those are far and few in between. So I can
Right.
I can definitely understand that. Now, are you actually terrified to go to work during this pandemic?
No. I kind of said it earlier. I'm one of those that I mentally prepare myself whenever I go somewhere. I mentally don't think about it. I mentally just go in and I do my job. One thing I have noticed since being at work that it's slower because a lot of patients don't want to come in, which honestly sometimes scares me because people are staying home and maybe even dying from that because they're staying home when they're like, oh, my chest hurts. I don't think I'm having a heart attack. I think, it might be gas, it might be something else. And you're dying. So
Uh,
you need to come in. And then you have the ones that are coming in and they really are sick and they really need medical attention and help, or they waited too long. But for me personally, I'm not scared to go to work.
gotcha. Wow. That's pretty serious. I mean, I'm gonna tell y'all, man, Lionel B, I'm afraid to check my mailbox, let alone go in there. But I mean, if it does happen, of course, I'm gonna seek medical attention. But I can definitely understand, just the fear. But you sound like a strong woman that you definitely ain't scared to go to work.
I
Um,
mean, you have no choice.
right.
You have to do what you have to do, right?
Absolutely.
And this is what we're in it for. I mean, when you made a commitment to be a nurse or a doctor, you made a commitment to save lives and help people in need. I mean, like I say all the time, Corona, yes, scary, but I mean, we've been seeing illnesses for years. I mean, we see all types of things and lice and things that can get you and scabies and all types of stuff. So this is not something that's different or new. I
Yeah.
mean, we should have been protecting ourselves from the beginning. And that's the thing that worries me is what have we been doing before this hit? We should have always been bleaching. We should have always been washing our hands. We should always been using hand sanitizer and masks. Don't just start now. You should
Right.
have been doing this.